Hello, my name is Dr. Karen Allison. I'm an ophthalmologist at the Flaum Eye Institute and a glaucoma specialist. Glaucoma has been a major health concern for many years, and its incidences will increase over the next 30, 40 years because of the increased aging in the population. Glaucoma is one of the leading causes of blindness, and because of that, it's become a real epidemic. There are many risk factors for glaucoma, and I'll just name a few of them. And one of them is family history. So if you have a family history of glaucoma, you have an increased 3 to 4 times increased risk of getting this disease. There's certain ethnicities, for example, African Americans or Black patients in general, and also Hispanic American, certain ethnicities that have an increased incidence of glaucoma. And there's some glaucomas that are more common in the Asian population, and this includes narrow angle glaucoma. The only way to really get it diagnosed is by seeing an eye care provider. So the disease is diagnosed by by checking the pressure, the intraocular pressure, by examining the angle of the eye to see if it's open or closed, by looking at the optic nerve to see if there's any changes in the optic nerve, any damage, by doing a visual field test to see if there is any damage in the visual field, and also to take pictures of the optic nerve to see if there's any damage to the optic nerve. Open angle glaucoma, usually we start with drops, and there are many classes of drops. Some are once a day, some are 3 times a day, some are twice a day. And it's very important that you're compliant with the medications, because if you don't take the drops, then the pressure is going to be elevated, or elevated to the point that it causes damage to the optic nerve. The other way is by laser. There are certain types of lasers that can treat open angle glaucoma, and the final way is by surgery. So we can either do certain type of minimal invasive glaucoma surgical procedures. That some of these can be performed with cataract or standalone procedures. The most important thing that any patient diagnosed with glaucoma is to educate yourself. Learn about the disease. Find out what your risk factors are. If you have family members, tell them that you're diagnosed with glaucoma, so they should get their eyes checked. The other thing is that you need to see an ophthalmologist, and you need to be or optometrist, and you need to be consistent with your follow-ups. The third thing is that you have to take your medications. It's important to take your medications to prevent the further damage to your optic nerve and further damage from glaucoma.